Throughout Millard West, each person, whether student or staff member, has a unique characteristic that they carry with them. In the month of November, there are several students and faculty members that can be brought to our attention in order to spread awareness.
Hi, I'm Faith. I have type 1 diabetes.
November is a significant month as it represents those who struggle with diabetes on a daily basis.
The basic that we see in high school is a type 1 diabetes, and that's where your pancreas isn't producing enough insulin. Insulin is used to push the glucose, the sugar, out of the bloodstream into the cells so it's utilized. So if you don't have insulin to push that into the cells, your blood sugar elevates in your blood, causing symptoms, and if left untreated, can be life-threatening.
Even though a person with diabetes cannot be spotted through their physical appearance, it does not take away the intensity of the metabolic disease and the manual labor needed.
Type 1 diabetes is such a difficult disease to manage. Everything affects your blood sugars. Obviously, the food you eat, but it can be exercise, it can be the outdoor temperatures, it can be if you have a cold, it can be if you're tired.
Students go on to explain their biggest hassle with dealing with diabetes on a daily basis.
Sometimes I have to get out of class, go to the nurse if my blood sugar goes low. So if I'm low at the end of the day at school, I can't drive, so sometimes I'm late to work or missing class for low blood sugars.
Some students have been diagnosed recently, which requires help from other members at Millard West.
We have kids that are newly diagnosed that need a lot of assistance. I've had kids that I've needed to give the actual injections to, help test their blood sugars for, help calculate the carbs that they eat at lunch so they know how much insulin to take. To kids that have diabetes for years since they've been infants and they need little to no assistance at all.
Being a diabetic requires an abundance of different equipment, which can be extremely pricey.
Right now, diabetes is one of the most expensive diseases as far as what patients have to pay.
Diabetes isn't only hard on the diabetic, but also affects loved ones.
Well, I think anytime you have a child that has something that they're battling, it's very hard for a parent because you want to take that on yourself. It's hard that I had to realize that this is something that my son will have for the rest of his life and he'll have to manage. And so it's hard giving him this tremendous responsibility at such a young age. He was diagnosed at 23 months, so of course, as parents, we managed it for many years, and now that he's 12, we are really transitioning him to take care of himself and learn healthy habits so he can take care of himself for the rest of his life.
This has been Bailey Christensen and Mackenzie Gonzalez with the MWHS Wildcat News.